subject now. This is about the CAS report. Doctors with decades of experience have resigned from the British Medical Association because of the union's opposition to the CAS review. Now, we covered the CAS review in detail here on this channel for many weeks and months, and hundreds of members of this union have gone public to voice their dismay at the union's stance after its leaders rejected the findings of the review and called for the ban on puberty blockers to be lifted. Just to remind you what happened, Hilary Cass, who is a brilliant consultant paediatrician, did a really great review looking at the use of puberty blockers in young children. And she basically said, and the upshot of that review was saying this is ideology over clinical evidence, and actually this is not good practice. And remember, the first rule in medicine is first do no harm. If you're going to harm someone, then you shouldn't do it, and that is our first rule, and we stick by that. And she essentially said in this review that children had been let down because there wasn't reliable evidence about how you have safe transitioning of children. And it's worth saying that also, I think, childhood and teenage years, it's a time of experimentation. You're trying to get to grips with who you are and understand yourself and all the rest of it. And so emergency legislation was passed, and it said no patients, new patients under 18, would be given these puberty blockers if they were experiencing gender dysphoria. And we can talk more about the detail of the CAS review. But the British Medical Association essentially has said they don't like the outcomes of that. This is a trade union for doctors. This is not about actually looking at clinical evidence. Well, as a result of this, 1,400 doctors, including 900 who are members of the British Medical Association, have signed an open letter calling for the BMA to accept the review's findings. So there are 70 professors, 23 former or current presidents of medical royal colleges who have written to the BMA to say their stance is unacceptable. Well, joining me now is Mayor Forstater, who is the CEO of Sex Matters. Good afternoon to you.
Hello.
I'm absolutely gobsmacked. I'm not really, in some ways, because I've had a fight with the BMA for some time about their stance. They have become an increasingly militant organisation. They are behind the junior doctors' strikes. We've spoken about Vivek Trivedi, Rob Lawrenson and so on. But I don't know what your view is, but the CAS review, for me, I felt was such a semblant, important kind of watermark in this, because we were getting increasingly confused about using puberty blockers in younger and younger people, and I felt her review was a very competent one. There was great evidence, and it was very considered.
Absolutely. I think, you got it right when you said this is ideology over evidence. Cass took 4 years. She commissioned systematic reviews. Her team looked at all of the case notes of the children and young people that had been through the Tavistock, and what they found was alarming, that these children were being given puberty blockers for which there is no good evidence that it supports their mental health, which is what it was justified as doing. And so, as you say, that has been stopped. The Tavistock GIDS clinic has been closed, and she recommended more holistic care, looking at children's mental health, all of the issues that they're facing, including autism, eating disorders and so on, rather than just honing in on gender as being the issue and the answer. And for the British Medical Association, which is a trade union, it should be there, negotiating doctors' pay and conditions, but not questioning this 4-year report.
It seems extraordinary, and as you say, it was a really clever piece of work. It took 4 years, as you say. They essentially said no puberty blockers to kids under 18. She even went so far to say under 25 you need to be very careful, and you mentioned this as well. 97.5% of children seeking sex changes had other things, autism, depression or other problems. I do not understand why the BMA are going against the principles of evidence-based medicine, which is what essentially medicine should be grounded in.
I mean, clearly it's not the whole BMA. It's Indeed. These. I mean, there are 59, I think, members of the council.
69.
Or 69. We don't know how many voted on the day, but it's a very small minority of the doctors. And as you say, the ones who've signed these letters, 23 current or former presidents of royal colleges. These are really serious, heavyweight people.
Yeah, I mean, as you said, they looked at 237 papers from 18 countries. They had a total of 113,000 children and adolescents. I wonder what your thoughts are then, given that we know that there are very few people, they put it to a vote of the council. You've got this overwhelming feeling from very, very seasoned professionals, professors of medicine and so on, saying the BMA is wrong. I just don't really understand what's going on here. Do you think the power's gone to the BMA's head a bit?
I think it must just be being driven by ideologues. I think it's the LGBT network has been making the running on this, and they are absolutely committed to the idea that there are trans children and that it's ethical to block their puberty, while all serious medical evidence is pointing in the other direction.
You mentioned the LGBT community and groups like Stonewall, for example, that have been very vociferous on all of this. And I wonder whether also part of this is actually because in terms of having gay rights, much of that has now been accomplished because I think there is pretty much parity across the board. And in some ways, they had to keep their organisations alive. And they've turned to this kind of campaigning because it actually fulfills their agenda.
Yes, I think that's right. And I think they might have got away with it if they hadn't have gone for the kids. I mean, it's one thing for adults to do what they like with their own bodies and their own identity and their own life. But it's quite another thing to sell to children the idea that if you're having an unhappy adolescence, which, you know, lots and lots of children, it's a miserable time for lots of kids. That maybe you're born in the wrong body, maybe you should take puberty-blocking drugs and cross-sex hormones and have your breasts removed and go ahead and have genital surgery before the age of 25. This is so far removed from what Stonewall was and should be doing, which was gay rights. And there are still countries in the world where it's illegal, it's criminal, to be gay, and that's the kind of thing that Stonewall should be fighting against, not trying to tell children that they're born in the wrong body.
Can I just ask you about your own organisation and what you try to achieve?
So Sex Matters is a single-issue organisation campaigning for clarity about sex in law and policy in the UK. So we just want the government to make clear that men are male, women are female, and that cannot change. And that's particularly important for protections for single-sex services. So things like women's prisons, rape crisis centre, women's sports, women and girls sports, all of those places in life where you do need to have a single-sex space. It needs to be clear that women means female, men means male. And at the same time, children who are too young to, they haven't even fallen in love yet, to understand who they are, should not be being sold the idea that they should change their body to try and be someone else.
So good to talk to you. Thank you very much indeed for your time. That's Mayor Forstater, the CEO of Sex Matters. Let me know your thoughts on all of that.